Typically, when a head injury occurs, the head and or the neck is torqued in a particular position where the brain then inside of the skull will hit the side of the skull, and that can cause a head injury. Later on, there are downstream side effects of that concussion that mostly affect the nervous system. That can affect the balance system. It can affect mental memory and cognition. It can affect our sleep. It can affect mood. It can affect our reaction time. It's really important that as soon as a parent or a coach or an athlete themselves identifies that they may have a concussion, that they pull themselves out of play. It doesn't always mean that they have a concussion, but at least they can be evaluated on the sideline by an athletic trainer or another healthcare professional who can decide whether or not they have a concussion or not. If at the time that they are pulled out, it's decided that they have a concussion, then they need to make sure that they stay out of any sports or any contact activities and do seek help with a medical professional. It's preferable to be sent to a physician, someone who does manage concussions if possible. And then the athlete will be put into a protocol where symptom monitoring will occur. Specifically with school now, there is a new return to learn protocol. This was adopted via the state law in July 2019. That protocol includes making sure that an athlete is totally up to their schoolwork mentally, and that is the first step in returning them back to school. After that, they will be slowly returned to their sport on a return to play progression, and then eventually they will get back into their sport. Typically, the timeline for this is anywhere from about 10 to 14 days, and usually athletes return in about 2 to 3 weeks. But I do tell parents and athletes that there's no hard set rule because everyone's brain heals differently. When an athlete's brain is injured, the entire nervous system is really kind of on overdrive. And so sleep is really important, especially in the first 48 hours, to try and let that brain reset. After that, it's important to get onto a normal sleep-wake cycle and really try and avoid napping if possible. Most of the time, athletes will feel like they want to nap in a lot of different ways for the first week. But for the most part, we recommend that they can nap as much as they want or sleep as much as they need to the first 48 hours. But after that, for their brain to re-equilibrate back into daily activities, it's important to get back on that normal sleep-wake cycle and usually try to only sleep about 8 to 9 hours a day like they would normally. So we used to think that screen time was a big issue, and it does often trigger symptoms, but it doesn't trigger symptoms on every athlete. And again, as we're trying to get our brain back used to the activities that it used to be doing before a head injury, we want athletes to try and do screen time. And so what I recommend for parents and athletes to try is to do some screen time and then take a break and see if they can do 15 to 20 minutes and how they feel. And if they're feeling fine, they can actually do as much screen time as they want. Certain things might trigger symptoms more, such as action movies or things where there's fast-paced objects flying, things like that when they're watching that on a screen, or sometimes reading on a computer can be difficult. So it's really individualized, but I tell people if you have a bad reaction one day where your body maybe gives you a headache or you get some sort of a symptom, don't think that you shouldn't try that activity the next day. And eventually the body will start to realize that it's okay to do those things. It just doesn't want to do them at that time. So we have to kind of slowly get them back into those activities over time. But screen time really is actually okay as long as it's not bothering the athlete.